Hi, you guys. Welcome back to another episode of Janine Between the Lines, Literature and Lifestyle for Leisure. I know it's probably long overdue, and I completely understand if this is an episode you decide to skip over because everyone's kind of looking for an escape out of this pandemic culture. I wonder if I can term that. Maybe trademark it. But as you all know, which actually, do you all know? Have I updated since my career change? It hasn't been much of a change. I'm a traveler nurse now. And today's episode is going to be an OTT. Also, we should play a game. How many location changes can I have in the span of publicly broadcasting this podcast? Because I'm in a new place now, and hopefully this one will stick around for at least a year or two. I moved over to Virginia, right outside the DC area, with my partner in crime, and yeah, today's episode. I thought it would be really fun to kind of record an episode. Some people wanted to call it the COVID Chronicles. I've just decided to call it the COVID Chronicles. So basically, I've got a few recordings and submissions from a few of my colleagues and friends who share the same profession as me in some sense, or just are healthcare professionals during this time. And I kind of wanted to get their perspective, short little submittals of how the pandemic has affected them. And I'm kind of going to start it out with a conversation that I had with two of my closest friends back in Nashville. So if you're excited, and if you want to hear what we as nurses think about this little COVID-19 time of our lives, then just keep on listening. The listeners have met Riley before, because we did one together. Sydney, you need to listen to that one. But
I'm a repeat guest.
She is a repeat guest. But everyone, this is Sydney Connor. Sydney, introduce yourself and tell us one interesting thing about you.
An interesting thing? That's a little putting me on the spot here. I don't know. I'm a nurse like Riley and yourself. I work at Vanderbilt from New England, and I don't know. We are just...
She can sail.
Yeah.
That's what I was going to say.
I like to ski, and I sail and do things outside.
And you're a freaking smoke show, dude.
Okay.
Yay.
So I've been debating on, like, the way that I kind of want to structure it is we'll kind of go around, and either Riley or Sydney, I want you to tell me your thoughts on COVID-19 when it first started hitting social media. Because my first impression of it, I feel a little bit ignorant. Like, being in the medical field, it kind of just emerged with memes. Like, that's how I first was exposed to it, and I kind of brushed it off for quite a while.
That is like a really good point, because I vividly remember having conversations with my dad when he called on the phone, and even my boyfriend Steven when he was in an airport, and he was like, oh, kind of strange, this coronavirus is like, people are wearing masks in the airport. And I was like, it was a joke almost. It was like, oh my gosh, that's ridiculous. Mm-hmm. And it was kind of like, don't worry about it, just wash your hands. More people pass away from the flu every year. Mm-hmm. So I totally agree with that. I felt like we were very ignorant in January, February, when all this was starting.
Mm-hmm. How about you, Riley?
Yeah, I agree. I'm kind of like, embarrassed at how much I like shrugged it off at first. Especially because with like definitely media, like social media especially, was how we all like first heard about it, I think. And I feel like people tend to either like way overreact to these kinds of things or way underreact. So I was like, I'm like, it'll run its course. We've gone through things like this before with like Ebola and Zika and H1N1, like all that stuff. Like, this is just one of those. Like, you just keep on doing what you're doing, wash your hands. But I don't know. It's definitely more prevalent.
Yeah. Very prominent. And I feel like I felt that way for selfish reasons too, because we had a trip. We were planning to go to Gatlinburg for a freaking girls #weekend.
Yeah.
And I also had a trip to Utah, and I think I agree with that timeline. It wasn't until March, like beginning of March,
that it really started to populate in the United States.
And I just remember anyone who would ask me, I would say, like, you'll know when it's serious when the healthcare professionals start to make a big deal about it. And then I was like, oh crap, look at what's going on.
Yeah.
How has your life changed? Like, not even just you personally, but what's kind of different that you're seeing now that it is kind of a big thing in our like healthcare environment? Is pretty much the tide has changed, but like, how are you coping? Are y'all all right? Is everything fine? Sydney, I know you've got a lot to say.
Yeah, I was gonna say, I think Riley and I have very different experiences so far because I actually tested positive I guess like 10 days ago now. And I'm feeling physically 100% recovered, but emotionally I've been so drained and so sad by all of this that it's just been such an emotional roller coaster. But I would say like the quarantine stuff that's changed, it's just like it feels like you're in a movie episode when you go out sometimes. Like people are
like an apocalypse movie.
Yeah, people are hopping off the sidewalk to avoid you. People are not looking each other in the eye. People in the grocery store wearing masks and gloves and stuff, and I feel like a lot of people just don't know how to handle this other than just to try to protect themselves. But I don't know. Riley, can you speak to any of that? Or
yeah, I mean, it's such a weird thing because it's like so important to be careful, obviously, and to like protect yourself and others by social distancing and washing your hands and only going out if like absolutely necessary. But I feel like for some people it's like made a like just this weird mentality of like fear of other people, and like not like we're not being kind to one another, but it's just changed the way that people interact with each other.
I was about to take that like way too many steps forward because I was like, are we losing our humanity? Because in my experience, I mean, I guess you could call us essential workers, very essential at this time, but I had a patient yesterday who was there for not exactly like an emergent surgery, but she was there. And I work in quite a small hospital where right now they're trying their best to make every room private rooms, but we're used to semi-private. So she was not degrading me in my hospital, but she was pretty much, because we're not required to wear our masks yet. Are you guys required to wear masks like all around your floor?
If you have
changes
exposure
every day.
Yeah, I think you're welcome to wear a mask.
Yes. It's optional, and
it's not required.
What she was telling me was basically like she was popping off because one, she was put into a non-private room, and she was like, I'm a social person. I love people. I need to but if you guys have empty rooms, I don't understand who is the brains of this operation, but we need to be social distancing. We need to do this. I know I'm not a medical field person. I'm an accountant, but this is this. And she's like, and quite frankly, I can't believe that you're around me. You're not wearing a mask when you're taking care of me. And I know that you don't have symptoms, but you have no idea if you're a carrier, this, that. And she was upset. And a few of my aides were helping her. She was upset that they weren't wearing gloves with everything that they were doing. And she told me that she wears gloves to the grocery store. And
Yeah.
I think
It's like there's so many. We've talked a lot about this on my floor. There's just like so many factors, and I've heard different stories every day about like, is wearing a mask just preventatively, like even if you don't have any symptoms, is that just a waste of a mask when there's like a nationwide shortage? It's like, is it more irresponsible to wear that mask and like not have that one for when you really need it, or is it more irresponsible not to wear one even though you don't have symptoms? And it's like a lot of like patients get angry with us, and then like people from our like service center get kind of mad because they're the one distributing the PPE, and then different things from our like educator. And it's just like sometimes it's easy to feel like we're being criminalized for just trying to do the right thing. And like no one has a clear answer on like exactly what the right thing is.
yes.
And like it's just weird because our job is literally to like help people and like do no harm. But usually we have like a lot more clear instructions on how not to do harm. So it's weird.
I think I work in the operating room, and we always wear a mask. Like that's part of our uniform is to wear a mask in the OR. So it's been kind of interesting because they typically, when the times were normal, we have like 5 to 6 different masks that we can choose from that are preferences. People like this one versus another one because it feels better, whatever the preference is. But they have removed every mask. We have to sign them out at the front desk at the beginning of the day.
Oh my God.
And we are asked to use that one mask throughout the whole day, throughout all of our cases, when in like normal situations, you're supposed to change that mask during every patient or every case, So I think that it's just so crazy to me. What I've seen with the PPE issue is how they've gone back on standards. Because we've, all of our standards, we used to get in trouble for not covering our cloth hats with one of the surgical sterile hats.
Right.
And now they're telling us, please bring your cloth hat and don't use anything else. Like, you are responsible now to wash your own hat. And you know what I mean? It's just like everything that they used to go by has kind of gone out the door.
That's wild.
Yeah.
I feel like we're going to run into a lot of lawsuits and stuff following this.
Yeah, the patients that are in the hospital right now have the right to be very anxious and scared, I think.
It's like I try to put myself in the position of like if it was like one of my parents that was in the hospital,
right?
Like, what would I want the healthcare workers to be doing
around them?
But it's just so hard to know.
It's a weird time to be a nurse.
Yeah.
And I think we're so young. We're only 24. It's not like we've been nurses for 20 years and have this all under our belts. Like, we are very new and still working it out.
I don't like it. You know what else I've been feeling? Just to piggyback off of what you were saying, Sydney?
What?
Like anxious and like borderline depressed for me.
Yeah.
And I think all of us can attest, like, we have days when we want to go out and be freaking wild, but I'm kind of a homebody. I think that I am a homebody, but you know that feeling when something's taken away from you and you just miss it more. Even if you didn't do that certain thing, you're like, oh, it makes you sad because you can't actually do it.
Mandated to stay
Yeah.
inside. It makes it a lot less appealing.
Yeah. And
I think another thing is that we moved down to Nashville away from our families, and like now more than ever, I wish I was close to my family. And it just makes you think I'm assuming there are just so many people in that same boat that aren't even nurses, people that are just away from their families that can't even cross borders if they start shutting things down. And if, God forbid, anybody gets sick, what are we gonna do?
Like, I was just one of my roommates here. She lives in Ohio, but one of her coworkers had a visitor come from Florida that was supposed to drive up, and apparently, if you don't have a Florida driver's license, you're not allowed like into the state anymore. Like they were. I'm thankful that, you know, I don't think that we would run into that problem if it was like work related, but
I agree. I think as long as you can prove that you're a nurse and working during this time, or any critical type of employee.
But I just can't believe that was one of the things too, that at first I was like, there's no way. And my boyfriend, he works, he's military, and I remember him specifically say, sorry, Teddy, but he was like, he's like, no, they're not going to start controlling the borders, because he was in the same boat as me. He was like, the government, it's just a ploy, like it's publicity, and this isn't like as serious. It's not going to last that long. And then I think about a week or two ago, he was telling me how his home state of Maryland, they were starting to, or they currently are starting to fine people for being outside if it's not for a non-essential activity. So say you're with your kids playing outside or riding your bike, you could get a fine for like disobeying their government's orders.
Right. I've heard that was happening in like some European countries too.
Oh my God.
Yeah, I know. I don't know the details of it, but I've heard that that's happening. So it's just, and then like specific to Nashville, like we also just had the storms like a month ago. And for those people, like now there's like shelter at home. We have to stay inside and social distance. But like those people that their houses were just like completely destroyed, like where does that leave them?
They don't have a home to go to.
So it's just like another factor.
Yeah. Did you see on the news that there's like a record of about 6.6 million people filing for unemployment?
Yeah. And then this is like kind of in relation to that. So at least at our hospital, like our census hospital-wide is like lower than it's been in years because everyone's avoiding the emergency room because everyone's staying at home and doesn't want to be around people who are sick. So for units like mine, like a cardiac step-down unit, our patients are like, we have 22 beds, and the other day we only had 9 patients. And they actually yesterday just closed our unit. So it makes like, so all of the nurses on my floor are like unsure how they're going to get their hours in. So it seems like we should be the most like needed staff out there. So it's, yeah, that's definitely
that's a whole nother added stress about job security. And you said a coworker, her husband filed for unemployment, so she's the only one that's bringing in any type of income. And now that she's getting asked to go home early, that's just nerve-wracking.
She like is not technically a full-time employee.
I feel that on another level. Nobody, unless you're going to a crisis state. I've been talking about this to everybody because I was just on the job search. I just recently signed my next contract, but it was like pulling teeth. And I never in a million years, like even in this very crucial time, I was like, you know, everyone will always need nurses, which is true. But I was searching for a job in the Virginia, close to DC area. And what we were finding, all 3 of the jobs that I submitted to, they denied me. And the reasoning was this unit is closed because I work orthopedics and they're canceling all elective surgeries.
Yeah.
So I was really, really kind of scared because I was thinking, like,
Your job security.
Yeah, it's like never in a million years would I have thought that nursing would be a job that I would have trouble finding.
Like, when we first started in nursing school or started our first jobs, that's something everyone said to me is like, oh, you'll have job security for life.
Yeah.
And now it's like, oh, I guess nothing's guaranteed.
Another interesting level to all this is that Riley and I were planning our leases up in 2 months here, and we were planning to relocate, but now A, will we be able to drive home? B, will we be able to find jobs? Her camp might close for the summer, and it's just everything is just so uncertain for the whole world.
And again, I understand, and some people could be listening and be like, yeah, well, y'all are nurses, you don't have to file for unemployment, but it could be any of us. And I recognize that there are people who are very much worse off even still, and coming from a place of privilege, and the things that we are still able to live with and have a roof on our head momentarily, nothing is sure of at the moment, but we are still young, and I never thought that it would kind of get to this point.
Yeah.
And I'm not a dramatic person. I feel like I have tried everything.
Yeah.
To not downplay, but I have been very nonchalant to patients and to my peers. And I even told my mom, because she's dramatic. She's very dramatic. And even if it's not about COVID, but I told her, I was like, Mom, she's very religious. I was like, the Lord told me that we shouldn't worry, that we shouldn't just give it all to him, and whatever will happen to us, it's in his will. And I tell everyone, they're like, aren't you scared of the virus, that you're going to catch it? And I'm like, you know what? It isn't my job. I refuse to live in fear. I will do everything I can to be safe and to be careful, but whatever happens to me happens. But
well, I think that I mean, if you're interested in hearing my experience of being positive and having symptoms and whatnot, I can speak to that a little bit.
Yeah, I need that. I need it now, bad.
So like we said with the timeline, January and February, it was still very taboo. People were joking about it. March rolls around. The first week of March, I was on a ski trip in Denver out in Vail. And everybody was talking about it. We even watched the outbreak on Netflix. It was a huge joke. And what happens is 2 days when I get back from my flight, I developed a tight chest and a cough. And I was like, no way could this be it. No way. But I texted my friend the day that I felt it, and she felt it too. So we were like, okay, well, if we both have, there's no way that both of us, and we kind of kept in contact for that week. And I said, my symptoms are still there, but it's kind of developed into a head cold. I have a runny nose. And she was like, I drank a ton of water and I feel a lot better. And her symptoms went away. So the fact that hers went away and mine kind of lingered made me think, oh, this was probably just a cold from traveling. And then, a couple days go by and I ended up having my period. So with having your period, you get headaches and stomach aches and all the uncomfortable things that normally happen. So I didn't really associate anything different with that even, but I still had the tight chest and I could feel it in my sternum, right in that rib cage area. But then I was second guessing and I was like, could this just be anxiety of all this building up in March and being at work and hearing about the PPE shortage, you know, everybody was just so scared. I thought it was anxiety. I didn't go to get tested until I realized that I had no sense of smell. So as soon as I tried to smell some perfume and had zero sense of smell, I totally freaked out and Googled all the symptoms and saw that it was a potential symptom. So I went in and I got tested. My test took 6 days to come back, so I called out of work for that week, waiting for my test results. And it was funny when we got the results back, because I knew I had it the whole time, and we were just like, I can't believe this. Riley and I both looked at each other and laughed when we got the results back. It was like, it's just such a weird, everything is just so weird, because I was totally okay. So it wasn't like I wasn't fighting for my life, but I don't know.
I guess on a closing note, just because my phone's on 4%, why do I always do this to myself?
I know, but we've been talking for 30 minutes.
Yeah.
So.
I know. Doesn't it go by fast?
Yeah.
I guess, actually, crap, I want to ask 2 things.
Okay.
We'll see how long I can last. That's what she said. But how do you feel about how the government is handling this, just from what we're able to gauge off of, you know, as a member of society?
A better question for Julia. Don't you think?
Julia.
She's so in tune with the government and what goes on.
She's
God.
I don't watch the news, and I try to avoid Mr. Trump himself.
Yeah.
Yes. Okay. That's a good idea. Is Julia working? Is that why she's not answering?
Sleeping.
I see. Okay. So I guess on a final note, what is one thing you want people to know about how to deal with COVID right now? If you were to give one piece of advice to all of my listeners out there, whether they work in the healthcare field or not.
I know what I would say.
Go ahead.
Say it.
I would say the concern is not for the young and healthy. Just treat yourself as if you were an asymptomatic carrier. Because it's about protecting those that are at risk, like the elderly or the very young or the immunocompromised. And you don't know how easily that things like this can spread. So just be mindful and be kind and just do what you're supposed to do.
For me, I would say, I think everyone is really going to appreciate their roles after all of this is settled, and we all hopefully can return to normal life and just be thankful for, everything that you have when you have it, because I think this has really just shown a lot of people that things can change on a dime, and nobody would have ever expected this to happen. But,
it's a reality check.
Yeah, definitely.
Yeah. All right, my honeys. Thank you for freaking talking to me.
Yeah, you're welcome.
I
miss you.
love you both.
Yeah.
I miss you so much. One night soon.
Yes, virtual.
Okay.
All right.
I love you guys. I'll talk to you
Bye.
later. Stay safe.
Yeah.
Love.
Hey, Janine. Oh, and your followers, good morning. Haven't done this before. Captain's log. Tuesday morning, April 7th, 2020, 7:52 a.m. My name's Gabe. I'm a paramedic, and I'm getting off of work right now. I work in a large healthcare system in the northeastern Florida region. I have about 5 years of EMS experience between the pre-hospital and the hospital setting. I'm also a nursing student in my second term. When did COVID-19 become a reality for me? It became a reality for me during spring break. I learned that a patient tested positive in the county in which I worked in, and I also learned that same day my spring break would be extended an additional week. Coming back to work while I was in spring break also validated the reality for me. If it weren't for the anxiety, the concern, and the anticipation over COVID-19, I'd actually have to say the ER right now is borderline delightful. The waiting room is empty. Only true medical and trauma emergencies are making their way in. Yeah. But don't get me wrong, everyone is on edge. Most of us are very fearful of course, transmitting it to the ones we loved and who we're staying with during this quarantine. Or also have a lot of anxiety over the predicted surge, really hoping that we don't turn out to be like New York. It's kind of terrifying. And in addition to that, just kind of frustrated with the healthcare system. And of course, sidebar, the government, obviously, but we have inadequate PPEs and disinfectant supplies. Yeah, that's really shitty. And we've all been exposed directly or inadvertently. But moving on. Otherwise, I'd have to say work is business as usual, besides waiting for the surge. What else? How has it impacted life? As a nursing student, it kind of sucks. Everything's online. Lectures are online, exams, clinicals, if you could believe that. But yeah, it is what it is. I don't mind riding this wave this semester, but it would feel very unfair if, for me and everyone in my cohort, had to deal with this up until graduation. I think nursing is very hands-on, and even being in a real classroom, I feel like learning is stimulated differently. But hopefully it doesn't come to that. Family. I stay with my folks, and I've only really seen my sister and brother-in-law in the driveway, and we tell them to stay at least 6 feet back while they drop us off groceries, which is really nice of them. A girlfriend, haven't seen her since spring break, which is 3 or 4 weeks ago. But yeah, that's what's impacting me right now. Advice, coping with the crisis. It is an opportunity. I think this quarantine, as sucky as it is, try to make the best of it. Stay occupied and be productive. Take care of your physical and mental health. I think a lot of my little spiel on mental health is, I think a lot of it, the negative part of your mental health, it spirals down from primarily boredom, lack of action, / purpose. So really do whatever it takes to not be bored and be productive. And I think I'm way over time. Sorry about that. Thanks for having me, Janine. All right, bye.
Hi, my name is Katie Hachuela, and I'm a nurse practitioner in Colorado with a private practice. And I just wanted to share my personal story in how COVID-19 has affected my life. Right now, I have been furloughed from my practice as people are not coming in for routine checkups and elective procedures. So that's definitely decreased the income coming in for my family. I've also been using this time to kind of reflect on what are my priorities in life. And I've just realized that, a lot of things can be taken away from you, but your health is really the most important thing. So through this time, we've really been exploring just ways to improve our health through diet, stress management, connection, and that's really what we've been focusing on.
My name's Tina, and I'm coming to you from Nashville, Tennessee, and I am a registered nurse on a trauma step-down floor. I realized COVID-19 was a big deal when I found out NYU was turning their dorm rooms into extra hospital beds in case the crisis got out of hand. And with all this noise going on, I realized that I've become more aware within myself. And I just want to give some advice. If you guys live alone and you feel lonely, I'm stealing this quote from Eat, Pray, Love, but make a map of it, get lonely. Now's the time to get into something you never thought you would get into, learn more about yourself, read more. And 2020 is still going, and this is still our year. So keep that in mind, and that will only make the future better. And stay healthy.
Hi, my name is Ashley. I am a med-surg nurse, and I work in a hospital in Melbourne, Florida. But right now I'm working on our respiratory isolation unit that just opened up, where we're taking care of patients who are either being tested for COVID-19 or have tested positive. As soon as a patient tests negative, we will just transfer them off the unit. So I've worked there for about a week now, and it's been an interesting experience. I realized this was a big deal. Honestly, it's really hard to tell now because time is all very much blurring together, so I don't really know, but I kind of realized, I guess, COVID was a big deal about a month ago or so, I would say. You know, once it was starting to get big in the U.S., we had cases in Florida. People were starting to make a bigger deal about it. We only got our first case here in Melbourne, I think, 2 weeks ago. And we only started getting cases in the hospital that I work in, So yeah, we're just barely getting started, I guess, with this. But yeah, so that's, I guess, when it started to affect me. It definitely had a big effect on me because my unit that I worked on, the med-surg unit, closed. We ended up moving off of the floor that we were working on. And then eventually our patient population dropped down so low that they ended up just closing us completely, and they dispersed all of us throughout the hospital. So I volunteered to be on the COVID team or whatever, because honestly I was gonna have to go somewhere new anyway to begin with, and I wanted to be a part of it, I think, but that definitely affected me. So everyone I work with right now is just dispersed throughout the hospital. And then I think since then they've closed 2 different floors as well. The hospital is empty. My sister works as a tech in the MICU and said they had 8 patients the other day, which is crazy. They normally have at least 20 to more than that, I think. So yeah, I think not only is it affecting people who work non-healthcare related jobs where they are having to stay home from work. Some people are getting laid off. Some people are losing their jobs completely and everything, which is awful. But we think that healthcare workers are, being slammed right now and having too much work. Actually, a lot of people are not having work because the hospitals are so empty. So it's just a super weird time. We don't really know when this thing is going to pick up. The hospital is totally preparing for us to get slammed the same way that we've seen places in New York get slammed and everything. But yeah, as of right now, we are not. I think we've got about 15 to 20 patients on our COVID floor, and I think we've got 4 to 6 patients last time I worked there that were positives. So we are definitely expecting that number to keep growing, but we will see. I guess if I had any advice for listeners on how to cope through this, I guess I'll just say what I've been doing. I've just been really trying to take care of myself, do yoga and exercise a little bit, go on walks, trying to just kind of still stay involved in the community as much as possible. But it's definitely difficult. Reaching out to other people is definitely a huge thing. But yeah, good luck to everyone out there, and everyone else who works in healthcare, definitely best of luck to you all. And I do know I definitely feel confident we will see the other side of this. Thank you for having me.
I hope you guys enjoyed that episode. I hope everyone's staying safe, and a little more regular scheduled podcasts coming in the future. So like, share, comment. Can you comment here? I'll favorite this podcast on Anchor, and I'll see you guys in the next one. Bye.